welcome to this first podcast on health issues in India and how IonCure stands to try to remedy some of those. I'm Sukant, Khurana. With me is Raamesh and Dr. Sharath Krishnaswamy. Raamesh is a co-founder of IonCure, along with me and Ronit. Raamesh is an advertising professional. Dr. Sharath Krishnaswamy is a physician and a science communicator. We'll start with first discussing the COVID-19 crisis. The reason to discuss this first is to sort of highlight the successes as well as some of the limitations of healthcare system, so that it gives us perspective of how one can go about doing our humble bit to sort of improve the situation. Okay. So Raamesh, what do you think have been sort of major achievements in terms of India's response to COVID-19, and what are the strengths of Indian healthcare system that have emerged?
I think from a citizen's perspective, this is something I can say, and I can also give you a perspective from system science or organizational science, which is that I think the Indian government and the state governments clearly realize that their health systems are not as much up to the challenge as perhaps the Western ones were confident. So I think what India did was to use this famous thing known as the seat belt rule. So people who've studied safety issues with seat belts have known that people take more risks when they are wearing seat belts because they think there is that safety already built in, you know. So India's healthcare system is like a driver without a seat belt. So India, I think, exercised a lot of caution, and its severe lockdown, even though it has taken severe toll on the economy and has had several other side effects, but I think that has had the effect of triggering enforced social distancing and flattening the curve, as they say. But I'm going to ask Sharath to explain from a medical perspective whether this was the right thing to do or not.
Basically, the West looks at us as a third world country, and the West and the other countries take pride in having very efficient systems. But there's no reason why we have to say that we don't have an efficient systems, because we have all that is necessary to contain a pandemic or an epidemic. The only drawback is our situation and the communities that we live in. I mean, one reason why polio managed to be eradicated was because of how the immunization schedule was enforced and the effectiveness of herd immunity. But this is a disease that we haven't seen before. It's called novel coronavirus because it hasn't affected humans before. So every other country has been facing, equal number of challenges as India is facing. And what's positive on the Indian side is we are a tropical country. The virus acts differently in different countries based on the weather and the conditions around it. And I think the genotypic profile of Indians also have seen to have, some sort of a defense against the disease. So that's what makes, one disease, act particularly different in one country as compared to the other. So. Yeah.
I would like to, I mean, some of what you are saying is at this level speculation, right? So genotypically, whether we are better equipped to fight coronavirus or not, we don't know. But the fact is that there haven't been as many mortalities, right? I mean, we are, despite being very overcrowded country, we haven't seen deaths comparable to Italy or US. And in fact, we have population almost 4 times of US. I mean, so we haven't seen even comparable numbers. Part of it could be underreporting and not adequate testing. But I mean, I have to give it to the Indian government that despite initial bungling, which is not very surprising, given the monumental task at their hands, they have been able to get a lot of testing. There was a report that just last 2 days, there's been a 20% drop in testing, but otherwise they were able to reach to 1 lakh figure, which I frankly didn't expect them to reach this quickly. So that's a lot of testing per day, but that also still means that it'll require some 37 years to test the whole population. if you were to test all population, obviously that's not required. You need to just test people who are exhibiting symptoms. There is some obviously, or had contact, even if they're not exhibiting symptoms. And that's where they have launched in an app, Arogya Setu, right? Has
Yes.
several pluses, has few criticisms also. So, and I think it always happens. In developing countries, people can be skeptical of the government. Data privacy laws are not very clear. So there are all those things. So, and there is not a culture of consent, right? So it's not that citizens are asked whether you want a mandatory app or not. And the government says, here is a mandatory app or here is demonetization, take it or leave it, right? So, but the climate influence was, there were initially a lot of speculation, right? That you would expect with a warmer climate, the virus to die much, but virus survives even 65 degrees for quite some time, 20 minutes. So just reaching summer 50 degrees, it may not. We have to see. The summers are there. It's still spreading. And one thing is there that despite the lockdown, we could not flatten the curve. India as a whole, right? I mean, there have been states like Kerala flattened the curve.
Yes.
But India as a whole has not flattened the curve. And it may not be any fault of Indian government or hospitals or everyone involved or citizens involved. It might also be that India actually acted proactively and it started early on. Every other country which started the lockdown, they started much later when it was already at the peak. Now, peak also is a funny business because there are multiple peaks, right? So if you look at the Spanish flu, that came at least in 3 major waves. So, and the second wave was deadlier than the first wave. So we do not know what is going to happen with COVID-19. But coming to you, Sharath, what, I mean, we do hear, I mean, news loves to work on the negative thing. And not just news, I think I have to admit, I am a hypercritical person, but that I like to think that criticism is meant towards improving things and not just to complain. But there must be several positive things that must have emerged out of this whole COVID-19 crisis. It told of stories of individual heroism of our physicians.
Yes, the thing is, I'm an anesthetist, so our job is to make sure that the patient is oxygenated and the patient can breathe when the patient cannot breathe by himself. So what we deal with is a lot of exposure to droplet infection that comes from the patient. So there have been accounts of doctors and anesthetists from Delhi, Mumbai, and other places, and particularly those who work in the critical care units for very long periods of time. And a normal job will be maybe a 3-hour or a 4-hour surgery, and you can walk out, go to the loo, or go and grab a cup of coffee, and then come back to work. But living in such situations means you're constantly exposed to the patient, and you have to wear the personal protective equipment, which is actually suffocating. Any mask that you wear is suffocating. And the kind of attitude that the doctors have towards it is, okay, this is our job, there's no other go, and they go straight into it. So that's a very positive outlook towards it. Only then society realizes that we are actually at the forefront. And we are also dependent on people around us. If the canteen doesn't work, we don't get our food. I mean, if we don't have places where we can crash and refresh ourselves, then we won't do our job properly. So these are just as important as us doing our work. So
Sharath, that's really great to sort of say that's a whole, it takes a village, right? So it's a whole ecosystem that is required. And in some places, despite poor resources, I mean, and you hear at times poor information amongst people. So this is very critical that people are misinformed and they are even not wanting people to be in their same colony. The healthcare professionals at times are being poorly treated because they are in a heavy exposure group. So that's a very sorry state of things. So at some level, there's tale of individual heroism of physicians, of citizens, helping even migrant workers at the time of crisis. But there are also horrible tales of, stupidity. So
the thing about stupidity is it's not confined to one place. I mean, we look at a few countries and look up to them thinking that they have everything sorted. but it's everywhere. As long as you are ignorant and you're not educating yourself, then your attitude towards things will also be affected.
Absolutely.
So, yeah. Stupidity is another pandemic, actually.
Yeah, stupidity, that's very well stated.
He was just telling me of how now that some restrictions have been lifted in Bangalore, people are traveling around, and while they're wearing masks, they're failing to wear helmets. And then there are now head injuries and surgeries for other things. So I think while the pandemic has taken a certain toll, the idiocy surrounding the pandemic is going to take its own toll. I wonder whether these people should be considered COVID casualties.
Oh, that's
not a laughing matter, but it feels sorry that, people are throwing precautions to the wind.
So there are two things to this. One thing that you mentioned was they're not wearing helmets. So they consider wearing masks priority as more important as to wearing helmets. So which means, according to them, the stigma or the fear of catching the virus is even greater than having an accident. So that is one thing, which is again misinformation. And with Corona, you could live for like maybe, 2 weeks or something, but with a head injury, you could be just gone in like a few hours. That's
absolutely. And with Corona, it's probably maximum fatality rate is 4%, right? Accounts vary from 1.6%. So majority of people, especially overwhelming majority of people who are in the healthy range, right? Unless they are elderly or having metabolic illness, recovering cancer patients, diabetics, the recovery chances are pretty high. So all these issues obviously are there. So that is one of the things that you said, which is highly quotable. Stupidity is, sort of a big pandemic. And I think that's why Raamesh has put in a lot of effort. I have put in some effort. We at IonCure, even though it doesn't make us money, we do spend a lot of time in various awareness campaigns.
Yeah.
And Sharath, you have helped us a lot in getting various physicians, psychologists at various times, and we previously released an app also, Entevota, that you take care of yourself, right, and your loved ones. So So awareness is at a core, because it's 1.3 billion people, and we are a startup. At least we are a bunch of scientists, physicians, engineers who really want to see this country do well. And some of us had not so great experiences. Like I had a horrible experience in academia. Raamesh has his own story. We've all struggled, but we all want to make the system good. And instead of trying to make it good by working in government sector, we want to do innovation in private sector. And I think that's one thing which is sort of good about this government. I have mixed feelings about the government, but one thing is that they are trying to push private innovation, and they know that free market is the engine of transformation, of real innovation. So anyway, so a lot of good stories at the side of physicians, and a lot of good stories even sides of citizens, and a lot of horrible stories also. We have even seen stories based on caste, right? And all those discrimination. Even in times of coronavirus, people are still fighting about their ethnicity and all that nonsense. But how about stories of hospitals managing in limited equipment? What are the positive stories that are coming out?
One of the most notable positions in history was the invention of ventilators, and this came primarily due to people who were suffering from polio. In the US and the UK, we didn't initially have ventilators. We had something known as a negative pressure ventilator. So it was called the iron lung, and used to have a room full of iron devices, and then creating a negative pressure atmosphere inside the device, and that was causing the patient to breathe. So what we realize right now is we've created positive pressure ventilators, and the costs of the ventilators are quite expensive. I mean, I inquired at different hospitals, and the cheapest was around 7 to 8 lakh. What the positive stories emerging out of this was a lot of established companies, even motor companies like Mahindra and Mahindra, they use the research and development wing to develop ventilators at a very cheap cost. So even if it is a third tier city in the middle of nowhere, having a lot of villages around, and the patients cannot afford to be on the ventilator, to afford a ventilator, ICU bed will cost around 30,000 to around 60 to 70,000 per day. So by scaling down the costs, we'll be able to help a lot more lives. So this was the first time we realized that there are other companies investing or using their equipment and resources to develop healthcare. So this will scale down the production of infrastructure in hospitals. This still needs to be thought out. We have to identify, whether the return on investment is more important as compared to a person's life. So it's basically a trade-off. I think the private companies as well as the government should understand, what to focus on. And this is an area of need which will actually need a lot of policy changes and a lot of implementation of new policies.
Absolutely. So you mentioned policy changes. So what are, again, some good policy steps that you think have been taken at a national level or some exemplary things at state level?
You'd like to know examples, or you would like to know what they should do?
No. I would like to know examples. I think what they should do, we should cover in a separate episode, and we should have a long episode on what they aren't doing perfectly right.
Okay. So what they are doing right now is establishing quarantine centers in many places. They understand that the infection has obviously come through a flight from a different country, and getting into a memorandum of understanding with the hotels and few areas to demarcate them and to treat or to quarantine passengers and to quarantine travelers, and to afford them, food, housing, and any medical help if it's necessary. So that is a positive. And to find out the containment zones in every area. They realize that it is an airborne infection, but it can still be contained in certain areas. So all of this has not been done so far in the past 20 years that I've been active in the medical field or been interested in the medical field. So this is a positive development. So this is a step towards maybe containing more pandemics in case we have to be.
Absolutely. Yeah. So
as a citizen, I have a question for you. And this is, I live in the hottest of hotspots in India, which is Mumbai, which has the most cases, and unfortunately is still fairly out of control, in spite of fairly draconian containment measures. But we are also dreading the onset of the monsoon. Do you think this droplet infection will spread even faster with the rain?
There is a possibility, but this will need a little more research, because unless we study how rains have affected the virus in places with a high rainfall, then we won't have any model to predict what is going to happen, in Mumbai, which is also a coastal city, which has a high humidity and which has varying temperatures, I think. So I don't know. Honestly, we're still studying how the impact of weather is on the virus.
Okay, because we had hopes as citizens, that people kept saying that the coming summer will kill the virus can't stand heat. But as citizens, we've experienced that in Mumbai, at least, it has had no effect on the virus. And perhaps the high humidity has only been a friend of the virus. So we're really dreading, because during the rains, the city gets waterlogged. There is standing water for many days. So we wonder whether an airborne infection can turn into a waterborne infection.
So yeah, so can I add something to it? I mean, the thing is that, see, it is spread through aerosols. I mean, it is also on surfaces where in some ways rain is helping you, because it's washing away things from any surface. But it's aerosol driven, and anything else that is also going to increase your chances of, let's say, asymptomatic or a symptomatic patient sneezing even more, right? Or people huddling in close corners. I mean, one of the crises, really crazy situation. I mean, whether you like the current government or opposition doesn't really matter. India is a country of very large number of people, and in some places the population density is insane. And social distancing for some, I mean, in a country like India is a luxury that, let's say, 3 of us can afford, right? But a poor migrant worker who's stuck in a small hut with 6 or 7 family members, right? they can't afford social distancing. Social distancing means you need to have multiple rooms. I mean, I live with my brother and father in a room of, in a house of 5 rooms. So we can afford to have, each one can afford to have our own room. So even within a house, there can be enough social distancing if we really want to practice it well. But that's not luxury that 90% of India has, right? So rains exacerbate that situation. Imagine, Raamesh, what will happen in Dharavi.
So
The
not
rain
just
over
Dharavi. See, Mumbai is a city with nearly 60 to 70% of its population living in slums. And if the rains come and it makes the social distancing impossible, then I'm terrified, literally.
Absolutely. So rain is not about just romantic songs and couples huddling together, pyar hua, ikrar hua, right?
Not in this
So
year.
it is going to be, yeah, it's going to be a very challenging time. Let us hope, I mean, we don't really fully understand this virus, right? There's still a lot of even conspiratorial theories out there about the origin. We know for a fact now that there were 2 strains at the time of the first reporting also. So not every strain of coronavirus goes back to the fish market exposure. So there were 2 strains, but strain doesn't really mean too much. I mean, just like all humans are different, every time there is replication of new, any kind of material, whether it's RNA in case of virus or DNA. So you have mutation. So that simply goes to say that there have been 2 divergence even before the first detection. So it's not just the November. So probably the virus maybe got a head start of a year with humans that we just didn't detect, right? So who knows what the time is? I mean, just like we now are even realizing about HIV, that it may, most of the work might have started in 1980s and the realization, but people have found a sample going back to 1966. It's also possible that in limited populations, before massive human migration happened, it may have been there, who knows for how many centuries, right? But at least we have a confirmed sample, nuclear material. So I think this has been a good start to finding out. So what are the, strong points? What are the challenges? We haven't discussed much challenges, but let's keep a second thing on coronavirus statistics in India and details of government response. Let's keep it in the second podcast, right?
Okay.
Which again goes to say, what are the challenges? The reason is, even though we are discussing health issues of India, but by specifically discussing coronavirus crisis, we will be able to say what are the challenges, how many hospitals are there, right? Which state has what numbers. So let's inundate, hopefully in a pleasant manner, our audience with what are the real challenges of healthcare in India. And then let's follow it up with what have been monumental failures. We are not here to take sides. We are not here to defend anyone. We want to present all the positives and the negatives and somehow explore what can we do, right? What do you guys say?
That's fine. Yeah.
That's fine. I'm game.
Okay. So thanks a lot, audience. We hope to catch up with you very soon with the next episode. Thank you.
Thank you,
And bye-bye.
Sharath, for joining us.
Thank you, Ramesh. Thank you, Sukant.
Thanks, Sharath. Bye.
Bye.
Bye.